Hi everyone. The other time we talked about microvascular complications of diabetes mellitus, and we've been able to talk about retinopathy, neuropathy, and nephropathy. And the question is, are there more organs that could be affected? And the simple answer is yes. So let's see. There is possibility of atherosclerosis. I have mentioned this while presenting points on heart attack. Peripheral vascular disease, lower extremity amputation is possible here because of impaired neural and vascular supply. Claudication, foot ulceration. From history, you're going to get all this. Foot ulceration, you check the physical examination because sometimes since they have neuropathy, they may not feel the pain and they may not even know. So you remove the shoes, remove the socks, and check interdigital ulcers is possible at the heel, posterior, malleolus, medial, and lateral. Check. Intestinal angina or mesenteric ischemia is possible. It's usually sudden, and it could be mild, but sometimes severe abdominal pain. Another situation, there could be blood in the stool. The individual could be having diarrhea and confused. If intervention is not done on time with the mesenteric ischemia, there's possibility of gangrene and intestinal perforation. And even when there is adequate treatment, it's possible that intestinal obstruction will ensue later in life because of fibrosis and scarring after healing. So mesenteric ischemia is possible as a macrovascular complication in diabetic patients. Coronary artery disease, we cannot overemphasize the need for appropriate treatment and checkup because that will prevent untimely death. As a matter of fact, coronary artery disease is the major cause of death in diabetic patients. Of course, myocardial infarction, acute coronary syndrome, ST elevated myocardial infarction or non-ST elevated myocardial infarction, unstable angina, and all the cohorts, they're all possible problems. Ischemic stroke is not far from these people because when there are plaques, thrombus formed, and for any reason there's thromboembolism and it's getting into the carotid, vertebral artery, going to the brain, it can cause obstruction of blood flow in the brain leading to ischemic stroke. The individual might initially have what we call transient ischemic attack, which would be a big signal to possibility of ischemic stroke. How do we treat here? I've just put this down not because that's the only thing you can do, but when you have GLP-1 agonists like Liraglutide or DPP-4 inhibitors like Empaglifozin available, you can use them. Why? Because they have cardiovascular benefits. And in addition to that, I've mentioned before, I think during the last presentation on microvascular complications, that now you use angiotensin converting enzyme inhibitor like ramipril, but if the person is allergic or reacting to it, then you can use a member of angiotensin receptor blockers. Why? Because AC inhibitors have what we call cardiorenal protective ability. So now we are fortunate that we have 3 different types of medication, actually 4. So AC inhibitor, angiotensin receptor blockers, GLP-1 agonist, DPP-4 inhibitors could all be used to help prevent cardiovascular problems in diabetes patients. And if that would be successful, I think, personal opinion, that less people will be dying due to diabetes mellitus, because coronary artery disease is the leading cause of death in them. And when the coronary artery disease is well taken care of, then mortality should decrease. So thank you for watching my videos. I will have more presentations and you'll hear from me soon. Please remember to subscribe to my channel so that you can be getting this piece of info on a timely basis. Thank you.